Hi, I'm Megan Belanger. I'm an oncology massage therapist and lymphedema therapist. And I've taken a number of courses on scars, and I've learned a bit about what scars are and how they're formed, why they're there, and how we as massage therapists can work with those scars to hopefully help them feel a little softer, a little bit more pliable. And I've loved these courses. I'm fascinated by especially how the body can be so adaptable to change to things like surgery and radiation. And this video is meant to show you some techniques that you can use to work on your own scar tissue to encourage that softness, that pliability, and hopefully help you feel a little bit more comfortable. So what is a scar? Scar is fibrous replacement tissue that the body lays down after injury or trauma or surgery. I like to think of it as in that area you're literally stronger than you were before with the type of tissue that the body lays down, and we're going to talk about that a little bit later. Now, after surgery, that scar tissue tends to be a little more localized, like along the line of the incision, and after radiation, it can be a bit more widespread. It's an inflammatory response that causes that tissue to get more fibrous, so that can be in more of a generalized area. So with scars, what's going on under your skin? What's happening that we can't always see from the surface? I draw an educational cartoon called Under Your Skin that helps to illustrate some of the processes that are going on in the body. And I started drawing it because it helps me to understand some of these concepts, and it helps me to educate my clients about some things that might be going on in their body that they might not be able to see. So let's talk a little bit about scars and how they're formed using some cartoons. So when there's trauma to the tissue, the nearby nerve cells are stimulated, and some of them are going to send out a signal to a special kind of cell called a fibroblast, and that's what we consider our construction crew that's going to be doing the work here. Now, our construction crew of fibroblasts starts laying down this tough, strong material, which is collagen. You might have heard about the skin being made up of parts collagen and elastin is that stretchy, flexible material. Well, let me tell you, this construction crew is not thinking about flexibility. They want strength. They want that over pliability, and they're going to work quickly. As soon as 1 second after injury or trauma, those fibers are starting to be created. And the idea is, let's close up this wound as quickly as possible. Nothing else is getting in there. It might not look pretty, but darn it, we're going to make sure nothing else gets in. So usually the construction crew stops laying down its collagen once the brain gets the message that enough strength has been created, and it can say to them, hey guys, you're done. You've done enough. And when that happens, when the brain gets that signal and the signal goes back to the fibroblasts and they stop their work on time, often that scar ends up pretty healthy. Sometimes the fibroblasts can get a little bit overzealous, they're putting down too much collagen, or they're laying it down in a haphazard manner, and that's when our scars can become pathological. You might have heard terms like hypertrophic scars or keloid scars, and they tend to be raised or red, they can be dense, they can be puckered, or any combination of those characteristics. And scar tissue, especially when it is formed in a pathological way, can cause what I like to call a snag in the pantyhose effect. So that scar tissue is pulling the surrounding tissue often inward toward itself and down, so it can sometimes bind down to lower structures underneath it, like lower, deeper connective tissue and sometimes even bone. And if you think about your layers of tissue, fascia, like those layers of phyllo dough, that flaky pastry, if you imagine those layers being squashed down and dried out and bound together, that's sometimes something that can happen with pathological scars. And those scars can also cause a dam in the lymphatic system. So if your lymphatic system, which is one of its functions is to help with fluid balance, if it can't get that fluid past that scar, if it's causing a dam effect, then swelling that can happen after surgery or after radiation, it might end up sticking around longer than it should. So when the tissue is dried out or bound down, like that phyllo dough that we talked about before, it can cause a number of effects in the body. It can cause tightness, it can cause tenderness, it can affect your range of motion, so you might not be able to move as easily or with as much mobility as you could before. Now this is where massage can come in. And starting as early as 3 weeks after surgery or radiation. And I say 3 weeks because that's usually a point where the scars are ready to be worked on. The incisions are closed up, the scabs have healed, they've fallen off, you're out of that wet spaghetti stage acute phase, and you're starting to move into the scar remodeling stage. And as we're working, we can help to encourage those fibers to be laid down in a more uniform manner. Now, when I say 3 weeks, one of the great things about scars is that scars that are months, sometimes even years old, can still benefit from this work, because that remodeling stage can last that long. It can go months or even years. So there have been scars that I've worked on that are years old, and this work can still help soften them up and keep them pliable. So scar mobilization works to create more tissue pliability. So going back to that phyllo dough analogy, if we think about opening up those layers and allowing extracellular goo that's in our tissues to get in between those layers so that they can slide against each other and create some more mobility. And this work can help calm the nervous system. It's gentle, it's pain-free. We don't want to do anything that is aggressive or deep, because we don't want to stimulate those nerve cells and have them call out to the fibroblasts again and have them come back and lay down some more tissue, because they've already done enough of that. Thank you very much. So this work is meant to be gentle and be supportive of the nervous system, and to chill that area out and not overstimulate it. And not to mention, this scar massage can help scars look better. They can look flatter, they can be less puckered, less redness, things like that. And this therapeutic effect of this massage on your tissue can cause things like less tenderness, less tightness, better range of motion. You're more able to do those motions that you could do before. So let's get started on that self-massage. I am a big fan of self-massage. You have the power in your own hands to help comfort you and heal you, and it's something that we do instinctually anyway. We do it naturally. If you bang your elbow on something, you don't just leave it out here, right? The first thing you do is you bring it in and you're rubbing it and you're touching it. So that's kind of the intent that we want to use with our self-massage, is thinking about it being comforting and nurturing and supportive. So when would we not want to do this work? Again, I wouldn't do this sooner than 3 weeks following surgery or radiation. You want to make sure that the incisions are closed up, that the scabs have fallen off, if there has been blistering from radiation, that has resolved. You wouldn't want to do this work if there are signs of infection around that scar, if there is redness, warmth, oozing, that kind of thing. Definitely not a good time for massage, definitely a good time for a call to your doctor. And we want to keep this pressure light. Remember, we want to keep that nervous system happy, so we don't want to think about digging down or breaking anything up. We want to keep things gentle. You'll see as we cut to the videos of the massage how little we really are displacing the tissue, how little we need to displace the tissue, that we can be gentle. And a lot of, in my work, there are folks that have had lymph nodes removed or radiated in an area, and so I'm thinking about not overtaxing the lymphatic system. And even if you're working on scars where there haven't been lymph nodes removed in that region, still working gently is going to produce some really great benefits. So depending on where the scar is, hopefully it's somewhere that your hands can access easily, but sometimes there's going to be places where we just can't get to it. So please feel free to show these techniques to a partner or a caregiver or someone who can perform these techniques on your body if it's somewhere that you're not able to access yourself. So before we start with these techniques, we're going to apply a little bit of oil. And we're going to cut to some videos that I did with a model. Now I do have some scars on my own belly, but they're hard to see, and so I literally just drew a Sharpie on my husband, and he's going to be our model for this video, so you can see just how much the skin is being moved, so you can kind of get a gauge of how much pressure we're going to be using. So we'll start by applying some oil, and you're going to do this sparingly. Clean hands also, so clean hands, you'll apply a little bit of oil. You don't need much, just enough that you can glide over the skin. You don't want to use too much because you want to have a little bit of stick to the skin. You don't want to go sliding right off of it. I tend to use sesame oil or jojoba oil in my practice based on someone's preference or if they have an allergy, but you can use whatever kind of pure, preferably organic oil that you like, whether that's olive or coconut or sesame or jojoba or things like that. So we'll apply the oil with our fingers. And our first technique is going to be the pin and stretch technique. This is when you are going to use one finger to pin the scar down at one area, and with your other finger you're going to slide along the scar, you're going to iron along the line of the scar, parallel to the incision. You can see there's not a lot of pressure that needs to be used, the skin is barely being displaced. We're keeping it gentle as we move along the line of the scar. Now you might feel certain things as you're doing this technique, or any of the techniques we're going to cover. There might be some areas that feel harder or more dense, like you can't glide over it as easily. And when you find these thicker, denser areas, you can pause. You can gently push into those areas of resistance, give them a little bit more intent, and then you wait for a softening to happen before you move on. And the softening can feel very subtle. It can take a minute or two, but you might be able to feel that tissue relaxing under your touch. And it doesn't take a lot of pressure. And the softening that can happen is totally the magic of scar massage. The next technique is moving across the scar. I tend to be even more conservative with pressure with this technique if I'm working with a newer scar, because I definitely don't want to have the possibility of an incision opening up. If you're working on a more mature scar, you can feel free to use the amount of pressure that's shown here in this video. So again, you're pinning the tissue down with one finger and moving the other finger perpendicular, gliding across the incision. And you can see there's not much pressure being used, the line isn't changing all that much. If you're feeling any burning sensation as you're doing this work, you can add a little bit more oil. So now that we have worked on the scar parallel to the incision and perpendicular to the incision, let's try to create a little bit of pliability by lifting, just in gentle lifting, to soften up some of the fibers underneath. So we're scooping inward and then a very subtle lifting upward, traveling down the length of the scar. And the intent, if we're thinking about that phyllo dough again, is softly lifting them apart. And finally, in the spirit of approaching our scar from all angles, we're going to do some circular motions, gently, working your way along the scar and keeping the pressure light. And remember, if as you're going you're feeling areas of more density, more thickness, you can pause there, you can hang out a little bit and let the tissue soften under your fingers. Now just to show some examples of what too much pressure might look like, this is that scooping, that gentle lifting technique. Look, not so gentle. So too much squeezing, too aggressive lifting of the tissue. My husband actually said ouch when we did this. And doing that circular motion again, too much pressure, you wouldn't want to do this. It's not necessary. Remember, we don't want to add any additional trauma to the area. You don't want to do anything that would cause any sort of redness or discomfort. Again, we want to keep it gentle, soft in tension. And also remember that sometimes sensation can be altered in skin that has been damaged, the nerves have been damaged or they're repairing, so you want to keep things conservative as far as your pressure goes. So you're meeting the tissue where it is instead of challenging it. And I feel like it would be remiss to not touch on the emotional impact of scars, because they can be reminders of things that weren't quite so pleasant. And sometimes people don't want to touch their own scars, or they can be nervous to do so, or it can make them feel sad. And yeah, sometimes that can happen. These scars are sometimes a diary entry etched on our skin, and sometimes these scars are things that we did not ask for. But they are pieces of ourselves, and I like to think of that. We're stronger than we were before, literally stronger than we were before in that area, because of our body adapting and healing from whatever happened to us. And that area still can be supported, it can be cared for, it can be nurtured, it can change. So that is a little bit about working on your own scar tissue. If you have questions, please don't hesitate to contact me. You can email me at megan@meganbelanger.com. You can also take a look at my website, meganbelanger.com, for more videos, for resources, for some more of those cartoons. Thank you very much.